Welcome back, everyone. Are you or someone you love suffering from addiction? Well, our next guest can help. Joining us today to talk about how addiction affects not just the person, but the entire family is Clinical Director for RiverMend Health Center of Atlanta, Catherine Baer. Catherine, thank you so much for being with us. I really appreciate it.
My pleasure.
You know, this is something I feel like people aren't always so open and ready and willing to talk about. Last time you guys came on the show, I felt like we could have had an entire show dedicated to this. When we were out of time, I was like, no, because this is such an important topic. And today we want to talk about specifically families, right?
Right. So I was able to be here with my medical director last month when she came and spoke, Dr. Cycle, and you very openly shared your experience with your father who suffered from the disease of addiction.
Right.
So I was really struck as I was listening and wondering what your experience was, because families are my passion, and I see so much pain and so much suffering without help and without support. So I really was just wondering, and I'm glad to have this opportunity to touch base with you again about it. Were you able to get help for you?
You know, it's weird. It's a really good question. I really don't talk about it much because unfortunately, I think when my dad was, going through alcoholism and even at a very young age, we all were dealing with it in our own way. And when he did go away to a treatment center and unfortunately he relapsed, no, we were all kind of in our own quiet, unhappy cycle that just seemed to go on for years. Like my mom was dealing with hers, my brother was dealing with his. I was in junior high, high school, really pivotal years, and just would stay in my room and never talk about it to friends. You're embarrassed.
Right.
Everyone else's dad or mom seems so normal. So to answer your question, no, I didn't even know there was an option to really talk about it. And I think, unfortunately, years later, as I was having weird, in relationships, like anger issues I realize now that I had seen a therapist that it was ways I was finally trying to deal with all those emotions. But no, back then nobody, I don't feel like, got the help that they needed when it came to that.
Right.
We were embarrassed.
Right. And unfortunately, that's still what we see, and that's why I'm so grateful to have this opportunity to talk with you and to speak to whomever is listening who needs help and who's probably suffering in silence. There's still that stigma, not just for the person who has the disease of addiction, but for the family members also. Like, you just were so willing. I'm happy that you were, not that you went through that, obviously, but that you're willing, because when you can put a voice and a face to the reality that people suffer in silence like they are, then somebody watching can get help that they need. And that's what I love having the opportunity to do every day. There's so much misinformation and misunderstanding about the disease of addiction. So I'm glad you've been able to get some help.
Right.
Later
way
on.
too long. Way too long. Nobody should have to go through that, and especially, as I was mentioning, in those years where you really needed to talk and you just don't feel like you have the support. So walk us through how the families get support as well. Everybody seems to be focusing on the addict. And the addict has tentacles that reach far beyond even the immediate family. They can unfortunately touch friends that they might borrow money from, or workplace, or steal, you know. So talk about then how the outside family and friends are getting help.
Yes. Something that I'm so grateful to have the opportunity to do with RiverMend is engage families right away. So we make contact with family members. I love, in my position, I get to meet family members when they'll bring somebody in either for an assessment or for their first day of treatment, getting to meet them. And you can just see this wash of emotion and relief that they're there in treatment. And then I get this opportunity to envelop and bring in somebody for all the support and healing that we can offer for family members as well.
Kids as well.
Oh, absolutely. I mean, kids, even when they can't articulate and they don't have the words, super intuitive. Our children are so intuitive, and they know what's going on. So we have wonderful licensed therapists who work with the families. Family therapy is a part of everybody's treatment, not just with their individual family therapist, but I actually lead the family therapy groups. There's a multi-family group, which I've been doing this for 21 years. And in my experience, that's one of the most powerful healing modalities I have ever experienced. Because
I can't even imagine what that's like, because that's such a foreign thought that you can get everyone in the same room and constructively try and help.
Absolutely. It's such a beautiful opportunity because the disease of addiction by its very nature tries to separate and isolate not just the identified patient, but family members as well. So family members, in trying to love their addict or alcoholic do so many things that end up being dysfunctional too. There's like the family members end up isolating and
covering up. My mom used to cover up if he didn't go into work. She's making the phone call. Back in those days, you know,
it still happens.
No accountability.
Yeah,
really. I mean, you know, you end up becoming like that co-addict or codependent.
Right.
One of the things that was kind of surprising to me when I look back is, so somebody goes through, if they're checking themselves in or their family's checked them in for a month-long, you know, stay there. What is the support afterward? What are you giving these families? Because I kind of remember my dad just like leaving, and then within months he had relapsed, you know, ended up relapsing like 3 times before it eventually destroyed his life, you know. So what do you do? How do you make it be like, bye, best of luck? I mean, these people need, and the families continue needing that help.
Well, the way I kind of see it, early in my career, I worked with cancer patients and their families and all types of diagnosis, all stages of diagnosis. And everybody in the cancer groups knew, family members included, that you wanted to monitor for tumor markers for 5 years. So best outcomes, you know, and everybody was on board with that.
Yeah.
And we don't see that yet with the disease of addiction. We're really behind.
Right.
So we want to see people being monitored, staying connected to support, because, you know, when you start to feel better, you're like, I don't need to go to the session, or I don't need the accountability, I'm good.
Right.
And that's so dangerous with the disease of addiction, because that's when it can get you. And for family members as well, because there's so much broken trust.
Yes.
And so there's shutdown in communication, there's shutdown in trust, there's all this separation, and we really work to help connect and heal families in the midst of something that makes no sense. The disease of addiction makes absolutely no sense. You're doing something to yourself that's trying to kill you.
Right.
Very counterintuitive.
Yes.
So there's a lot of shame involved, not just for the patient, but for family members as well. You can't talk about that.
Right, right. So it's incredible, the great help that you're doing. That again, it's been a long time coming. I know, from a family perspective. You know, just imagine the help and support, getting that, having that at your fingertips, and so you don't feel so alone. And if you or someone you love might be suffering from any kind of addiction, as we were just talking about today, pick up the phone, please. Give them a call now. It's 770-203-1614. Again, it's RiverMend Health Center of Atlanta, and we so appreciate your time. And this segment was paid for by RiverMend Health Center of Atlanta. Thank you so much.
Thank
Such
you.
great information. All right, and we want to keep this conversation going. So if you have a question for Catherine Bayer, please, as she mentioned, she's been helping families for more than 20 years. Email us at atlantaandcompany.com. Such an important topic, and we appreciate it. Thank you. All right, well, coming up.